Hi, my name is Mariana Isabel Mendiola Robles, and I'm gonna talk about the methods to study the brain. So first we have the behavioral reaction time. This is the time that elapses between the onset or presentation of a stimulus and the occurrence of a specific response to that stimulus. There are several types, including simple reaction time and choice reaction time. This is very easy because it already says in the name. The simple reaction time is when it is almost as an instinct, and the choice reaction time is when you literally choose how to react and when to react. So, it can be used to assess various psychological constructs like the speed of responding. An example in psychology is the investigations where the researcher might measure the time between presentation of various words with emotional connotations and a participant's indication that each word is either positive or negative. It is mostly used in ACT therapy. Here we have another example. The stimulus, the one that's in red, it appears, so a sensory neuron travels the signal to the brain or spinal cord, and then it reflects as a response, that is the one in green, with a motor neuron with a reaction. And the time that happens between all of that processes is their reaction time. Then we have another type that are the electromagnetic. First, we have the EEG, that is the electroencephalogram. So, it is a test that measures electrical activity in the brain using small metal discs attached to the scalp. This is the ones that we see in movies. During this painless test, small sensors are attached to the scalp to pick up the electrical signals produced by the brain. These signals are recorded by a machine and are looked by a doctor. The main use of an EEG is to detect and investigate epilepsy, a condition that causes repeated seizures. An EEG will help your doctor identify the type of epilepsy you have, what might be triggering your seizures, and how best to treat you. It is one of the main diagnostic tests for a lot of brain disorders. Some of its uses are to diagnose brain tumors, brain damages, sleep disorders, strokes, or, as already told you, epilepsy. Then we have the ERP, the event-related potentials. It is the electrophysiological response in the brain to a specific motor or cognitive event. We are gonna use the example of a stimulus. They can be used to monitor attention and fatigue by the reaction time. It provides an excellent medium to understand neurobiological dysregulations with the potential to evaluate neurotransmissions. It can identify and classify perceptual, memory, and linguistic operations. Here we have some examples. The first one is very similar, but the first drawing, to the two examples I already told you. Then we have CAT, computer and eggshell tomography scan. It uses a series of X-rays and computer to produce a 3D image of soft tissues and bones. The highly detailed images provide more detail about tissues, density, and location of abnormalities than plain X-rays. So doctors can precisely locate structures and abnormalities. It's a useful diagnostic tool for detecting diseases and injuries. It can find some brain and spinal cord diseases or injuries in neuropsychology. Then we have the PET, positron emission tomography scan. There are some tricky words here. It uses a special dye containing radioactive tracers. These are swallowed, inhaled, or injected, so it will glow and will help to see how the organs are working. This is very funny because it works almost like a glow stick that they put in your body so you can glow, and then they can watch how your organs work. This is tricky in the words. It is important because diseases often begin at the cellular level, and it helps to show it. It detects complex systematic diseases such as brain tumors, memory disorders, seizure disorders, etc. So here we have an example of how they can do it, and the one with the dye, as I told you, they can you can swallow, you can inhale that, or it can be injected to the body part they're gonna use. Then we have the MRI. This is very popular, if I can say it like that. The magnetic resonance imaging. This is a type of scan that uses strong magnetic fields in radio waves to produce detailed images of inside the body. So this is like the images I showed you before. It can be used to help diagnose conditions, plan treatments, and assess how effective previous treatment has been. It can be used to examine almost any part of the body, including the brain and spinal cord, tumors, and aneurysms. Then, last but not least, the fMRI, the functional magnetic resonance imaging. It measures small changes in blood flow, that occur with brain activity. It may be used to examine the brain's functional anatomy. It's becoming diagnostic method of choice for learning how a normal diseased or injured brain is working. This technique works like it relies on the fact that cerebral blood flow and neuronal activations are coupled, so when an area of the brain is in use, blood flow to that region also increases. So it can help you examine the anatomy of the brain, helps assess the effects of stroke, trauma, or degenerative diseases, etc. So that was all. Thank you for your attention.